started thinking about, let me kind of introduce myself and my experience. I've kind of been in and out of the medical field since I was 16. When I was 16, I got my CNA. When I was 18, I got my EMT. And then when I was 23, I joined the Army and I was a combat medic. For almost 7 years in the Army. I was regular Army, and I deployed to Iraq. This is a picture of me in Korea. I gave myself an IV, and the Korean soldiers that I was training had never seen an IV before, and they were like you're putting fluid in your arm. Like, what? They were blown away. It was pretty crazy. So after I spent 13 months in Iraq doing combat missions with infantry and with combat engineers and EOD, doing route clearance missions and close target reconnaissance. So I got to use my combat medic skills, let's say that, in the real world. Then when I got back from Iraq, I became a combat medic advanced skills instructor trainer, and I trained new medics for a while. And cool story, the medic that replaced me with Echo Company, with the engineers doing route clearance missions, his name was Stephen Evans. And one thing I told him, I was like, make sure every guy in your platoon, everyone around you knows their basics, knows the basic combat life-saving skills, knows the tourniquet, knows basic assessment. And sure enough, a few months into their tour, his vehicle got hit by an EFP, an explosively formed projectile. It's basically a shape charge, really high, highly advanced form of IED, roadside bomb. And it went through the armored vehicle and it hit Stephen in the leg, and it ricocheted him around the vehicle inside, like a ragdoll, and almost took his leg off. And everyone in the vehicle was knocked unconscious for a little bit, but luckily the other guys in the vehicle came to, and they did everything they were supposed to. They put a tourniquet on his leg. They saved their combat medic's life. So that made me feel really good. The funnest thing for me, aside from doing emergency stuff, is sharing that knowledge with people. So after that, I re-enlisted to go. I was at Fort Bliss in El Paso, Texas. Then I re-enlisted to go to the hospital. And I was lucky enough to get assigned to a surgical unit. I was assigned to urology clinic, so we were doing all the urinary tract surgeries. And I just had a really cool doctor who was willing to teach me anything I was really willing to learn. His name was Dr. Vanasupa, and I got to do a lot of cool stuff because it was a military hospital. I got to do a lot of stuff that civilians can't do unless you're a nurse or a doctor. We got to where he would finish the technical part of the surgery, and he'd be like, "You good here, Sam?" And I'd be like, "Yep, okay, you close up." And I would suture up the wound while he went and did paperwork. So that was a pretty cool experience. I did that for 2 years. I was a surgical tech. And then I was assigned to Korea for a year, and then I got med boarded out of the Army. And then after the Army, I was a professional EMT for a while, and I was a security guard at a hospital.
What's it mean to get med boarded out of the Army?
I got medically retired from the Army, from my injuries and PTSD and stuff. So yeah, actually as a security guard at the hospital, I did a lot more CPR and interventions than I did as an EMT. It was, you have, police unhandcuffing people and giving them to you, sometimes all that fun stuff. So my hand-to-hand combat training came in handy there sometimes, but that's kind of my experience in a nutshell. So we kind of wanted to make you this list of things that I could think of so let me just kind of have a disclaimer here. Everything that I'm teaching you this is for less than ideal situations. And I kind of was thinking about, the ideal world of a real hospital OR, which I experienced for 2 years, and then, okay, how can I do my best to recreate that for everyday people? What do you have at your house? And what you don't have at your house, what can you buy to be more prepared for this? And this is kind of the stuff we thought of. You kind of go through the list. You want a lot of sheets for the table you're gonna do surgery on. You want pillows. Okay, so sorry, I didn't explain like kind of what I'm gonna teach you today. Kind of this is like, I'm gonna teach you how to set up a makeshift OR. And like, the power is out, I don't have any kind of electricity, and someone is really, really sick and they're gonna die if you don't cut them open. That's kind of what we're gonna go through today. Like, there's no doctor available, there's no OR available. What are you gonna do? Are you gonna sit there and let them die? Or are you gonna take some risk? Because all of us take risk every single day in our lives, and we want to do everything we can to mitigate those risks. And that's a whole lot of what soldiers are taught in the Army, is risk mitigation, because obviously you're doing some pretty crazy, dangerous stuff. But, okay, what can I do to make it a little bit safer? So, kind of the scenario I was thinking of in my mind is like, let's say someone has acute appendicitis, and you've got to give them an appendectomy to save their life. Otherwise, they're going to die. It's going to blow up in their stomach. They're going to die of sepsis. And that'll be a horrible, painful way to die, by the way. So kind of, yeah, that's kind of what supplies you'll want. 6 sheets. Because why so many sheets? We'll kind of go through that. Yeah, and I'm going to ask you guys to comment. What were you going to say?
They get dirty.
Yeah, well, I mean, you're going to be there's going to be blood, you're going to be irrigating the wound, right? And really, really sick people, they can't maintain their own body temperature very well. So you got to keep rotating out blankets and stuff on them to keep them warm. So, and then a lot of hand towels. I like a lot of handkerchiefs. And obviously sterile towels are ideal. Less than ideal, a whole lot of handkerchiefs. Good for a lot of things in surgery. So a lot of packs of sterile gauze. It's not very expensive. And in surgery, you use a lot of it's like a plastic tray with 4x4 square gauze in it. I really love these roller gauzes for a lot of reasons.
Is there a way to sterilize sheets or towels?
Well, yeah, we'll kind of go through that more as I go through. There's 4 main ideas I need you guys to grasp onto in your mind when we go through this, after we go through this splice. But so you need irrigation. A cool thing that I thought of for irrigation. Water pick. So obviously, this is sitting in your bathroom, it's gonna be pretty gross and have a lot of germs. So flush it with a bunch of hydrogen peroxide. Pump all the hydrogen peroxide out, and then dump your fresh, clean, sterile or boiled water in there. And then yeah, you can irrigate. So then when you're irrigating, why do we irrigate wounds? Clean, and another big thing is see, exactly. You can't see crap if the wound area is filled with blood. So what are you gonna say?
What's the name of that?
Oh, this is Water Pick water flosser. And it comes with a bunch of different tips. Has the really sharp tip on it right now. But that's pretty high pressure.
Yeah.
So I would change out the tip if I was gonna use this for irrigation. But
So is that not electrical?
it is electric,
Oh.
but I'm gonna show you
Ways to.
when we're done with this classroom part, we're gonna show you some demonstration stuff out
Thanks.
in the gym area.
We need a volunteer.
Operate on me. Operate on me.
Yeah. You ready?
Elaine's
Go.
gonna
Go
volunteer.
for it.
I need one.
So if you don't have, One thing I really plan on buying is one of the battery powered suction devices that you have in ambulances. That's like my next thing, but good old fashioned
Yeah.
bulbs. And what do you have on the floor next to you if you're doing stuff like this? A bucket, yep. So you just, someone keeps irrigating, and then someone helping you keeps sucking the extra fluid out of the wound and squirting it in a bucket.
It was a
And-
large syringe.
Absolutely, that was my next thing. So a cool thing, I swung by IFA today, and I got some veterinary supplies for pretty cheap. I got a bunch of these were like $1.50 a piece. These tweezers were like $5.50 from IFA. These bandage scissors, which they're designed for bandages, but in an emergency situation, we're gonna dunk them in the iodine. We're gonna use them to cut flesh too. So these were like $11. Really cheap, really cheap. So
You can boil them.
yeah, exactly. Yeah, that's another thing we'll go over. So yeah, 60 millimeter sterile syringe, and some kind of cup, some kind of clear cup. About 1 to 2 cups in measurement. I actually bought so I'm going to show you what we're going to do with this when we're out doing the demonstration. What do you want something you can measure with?
You know how much.
Especially with, yeah, how much you're sucking out, right?
So you know how much to put back in, maybe.
And yeah, because if you've only put 1 liter of sterile water in there, and you're sucking out, and you can see you have 2 liters of fluid that's come out, you know how much blood your patient has lost. So a shallow tray, where's that? This is a cake pan. This is gonna be my instrument tray. I'm gonna dump. I'm gonna put enough iodine in there, and this is something really cheap too. Like, definitely buy bottles of this. And you're gonna put all your instruments in there. Are these surgical instruments?
No.
In a pinch. Good. Well, depends on what you're doing.
Yeah. We must be crazy, huh? Yeah,
AKA.
yeah. So we're gonna use these 2 things, and I'll show you why later, but
Finally, get used to them, so.
yeah, you never use them for cracking nuts, like, seriously.
You dig out the Brazil nut.
Yeah, I don't, but.
Throw up.
So sterile gloves. I would say this is not a very expensive thing. I think everyone should find out what glove size you are and buy sterile gloves. Like, yeah, I'm actually a size 9, but it's really hard to find size 9s, so 8.5's work.
How long do
Yeah.
they last before you need to rotate them?
Yeah, they don't even have like an expiration date. It just has a manufactured date. It says 2008. But as long as these stay dry, what happens with these if they get too old? The rubber breaks
They come
down,
down.
and you go to put it on and it just tears. But they're not gonna go unsterile as long as you keep them dry.
If you keep
These
them
are
in-
gonna last
if you
a
keep them in
ridiculous.
sealed plastic.
Yeah, and they
the
come.
Pollution will not make
So we'll
them
show
crack.
you. That's something I'll show you out in the demonstration area is how to put on sterile gloves and how to maintain a sterile field.
You also don't wanna keep them in a hot garage.
No, absolutely not. No. Yeah, that heat and cold
Yep.
will kind of melt that rubber together. So yeah, you need that clean robe or what in my less than ideal mind, just a good breathable long sleeve shirt. Oops.
Did you drop on the floor, make it sterile?
Yeah, so
One second.
And again, there's things, we're not gonna be totally sterile, but there's things we can do to help our cloth be much cleaner and much more sterile. We'll get to that in some more slides, but. So another thing you need is basin basin. Where those are, baby. who knows, you know, what's the generic name for bacitracin?
Neosporin.
Neosporin, yeah. Forgot to give these out. Who said that? Who said Neosporin? Okay.
Oh, he gets a
tell
prize,
everyone what it
all
says.
right.
Stop screaming, I'm scared too.
Oh, sorry. Yeah, so if you answer good questions, good.
That's, well,
This is true of all medics. Sometimes we're like, holy crap.
How
Yeah,
about
then-
going up above the bacitracin?
The one above, that's straight. Oh yeah, I forgot that one. Yeah. So you need safety glasses. Why do you need safety glasses?
How you can get it?
For a million reasons.
For a million reasons, yeah.
These came from Walmart, I-95, and they have readers in them.
Exactly.
And the sunglasses and the amber
Yeah,
green.
these were like $7. I bought these at Walmart today. Shooting glasses. But yeah, even in the OR, we had these special, really light ones that kind of stood away from our faces more to help
Gary?
the sweat.
They don't stand up.
You get a lot of sweat. So and then, and then sutures. Got a whole bunch of different ones here. So sutures, it comes with the needle on it and it's sterile inside this package. So this is 3O Vicryl.
So what do you get?
So the if you're taking notes, I would recommend taking notes on this part. Vicryl, chromic gut, or silk are the best sutures. Why? Anybody know? Take a wild guess. They're absorbable, exactly. You don't have to remove them.
Can you
They
repeat that?
so this is Vicryl, Vicryl.
Could you pass that around?
Yeah, yeah,
Take
sure.
a picture.
Let me get a
One
few
of them.
different ones. So Vicryl,
And where do you buy those?
you just kind of have to look online. Medical supply stores. There's like, so these are Ethicon brand. Yeah, you can just order stuff online. And a lot of times, you're gonna save a lot of money getting from veterinary supplies when it's just as good, honestly. So the key is, these are 3O. The smaller, it's like gauge. The smaller the number, the bigger it is. 3O and 4O are the best all-around sizes. So here's Vicryl, here's a chromic gut. Look at those. It's got the needle already attached. It's sterile inside there. So whoever opens it up is gonna peel it open, and we'll show you how they're. Whoever is passing you the stuff, they open the package and they don't touch what's inside. You open it away from yourself and let it fall onto the sterile field.
So there's no, any one of these three would be fine if you find the source of that.
Yeah, but I would just make sure, like, for example, 8O we used for really fine, hair-thin sutures with a tiny little needle. We used that for doing vasectomy reversals. So when you're finding two ends that are the size of a spaghetti noodle, and you have to put 8 stitches around that to make the tubes go back together, that's 8O. That's the small, tiny sutures. And then 2O is the biggest I know of, but 3O and 4O are the good sizes that you can do most wound closure with, and they're dissolvable. So if you have to do a layer inside the body, you have to stitch the abdominal wall back together. You can do that with chromic gut or Vicryl. Tie it off, and it stays in the body, it just absorbs. So bacitracin, we always use this in surgery, and these little packets are ideal. So whoever's gonna pass you this on the field, again, you tear it open, and you're not gonna touch what's on the sterile field. And this is a wound irrigation technique we'll show you. And you're just, oh, see, I mess up. Can't touch the sterile field with that one. See how serious it is? Like, gotta keep trying, like this. You don't want to introduce anything bad to your sterile field. So I can go like that.
Or put it down into the cup and just go.
Yeah, just let it fall in. So bacitracin, it's, you know, it's a natural, it's an antibiotic, an ointment, and it's petroleum jelly based. So like, it's just like Vaseline with antibiotics in it. So we would pour warm water, warm sterile water in there, and we would use the syringe and suck it in and blow it out and kind of stir it together. So you'd have warm water that's mixed with bacitracin. We would irrigate inside the abdominal cavity with that. And it helps everything be more slippery, and you're introducing an antibiotic to the wound area. And another use for the bacitracin, you have it put on your sterile field, and you take your suture, and you clamp your needle in your needle drivers, and you run the whole suture through that pile of bacitracin. So now all that suture is lubricated, and it slides through the flesh much easier when you're closing up a wound. So super glue, I'm sure you all guys all know. So this is less than ideal, this is a little bit more ideal. So this is just regular super glue, and this is actual liquid bandage. So a lot of times, like say, like if we did a testicle removal, and we cut in the abdominal wall right here, this skin is really tender. So we would stitch it closed, but we would also put a layer of medical grade super glue over the top of the stitches. Because a lot of times your waistband is on it, and it's gonna get really irritated. So kind of depending on the body, on where on the body you're gonna put those stitches, a lot of times you wanna put the stitches and close it up with super glue on top, because depending on the type of stitches, if it's a porous thread or a fibrous thread, it can get bacteria embedded in that, and the suture itself can bring infection down into the wound. So covering it up with super glue is an extra layer of protection. So, and then some kind of cauterization tool. We looked up, has anyone here heard of a Bovie? A Bovie unit? So it's a specialized electrocautery unit. That's kind of the standard of care now in surgery, is you're cauterizing little bleeds all the way through the surgery. Because every little bleed that you don't stop is just a tiny little weeping blood it takes the body longer to heal that up. So every tiny little bleed, the doctor would grab with what's called Adson forceps that I'll show you. It's like a little tweezers with 3 teeth on the end, really tiny. And he would grab the tiny little bleed, and then I would touch the electrocautery unit to the end of the tweezers, and it would just go and just seal it off just instantly.
Could you use a soldering iron with it?
Yeah, that was another thing. Good thinking. You gotta think outside the box. I have soldering irons, and I have wood burners at home that I would absolutely use for wound cauterization if I had to. Is this the video? No.
With a solar electric supply.
What we're talking about is
Yeah.
different kinds of generators. Solar, if you had good batteries, yeah.
Yeah.
An electrocautery unit doesn't use many watts. It's all about the frequency.
So I use a battery soldering iron everywhere. You know, take it a lot of places, and
Yeah.
they're pretty powerful. Just little.
Yeah, and they have. So Sarah and I were looking this up on the internet. I was curious how much a Bovie unit would cost. So a Bovie unit, you can adjust the frequency up really high so that the needle will slice right through flesh. And we did a lot of our cutting with electricity. So there's a grounding pad you put on the patient's thigh, and then it's just a button on this little pen-looking thing with a sharp needle on the end of it, and you just push a button and it slices right through.
So what if you're in survival mode? What if you don't have electricity? What if you don't have?
Yeah,
some of these things?
So yeah, if you don't have electricity, there's obviously some of these things you can't do, and hopefully you gotta have some way to. This is what we're gonna start covering.
So if you had a little bleed like that, could you use something like cayenne pepper on it, stop the bleeding?
Cayenne pepper is wonderful. That's, yeah,
Okay.
yeah, you need, oh, you already got
I
one.
got one, give it to me.
I asked the question of you.
Cayenne pepper is awesome, like,
I don't need a sign to say I'm scared.
no, yeah.
Now, these two people came in maybe after you mentioned that this is in grid down situations where
Yeah.
we don't have electricity.
Yeah,
Yeah, but
so
we're-
that's what I'm
so
saying.
what I'm gonna show you, the operating room I'm setting up.
Yeah.
We have a generator, and again, we're gonna talk about some more ideal things. Hopefully you can create your own electricity, and then some less ideal. And hopefully, my goal with all this is to get you guys to think of your own solutions and in your own house. What can you come up with? So this is hopefully as ideal as you can make it. These are the 4 crucial things that an operating room needs to be. First is clean.
Yeah.
So what am I talking about when I say clean?
You know.
As clean as possible.
Hopefully sterile, yeah, as clean as possible.
Yeah.
So, this room, for example, would this make a great operating room, just like it is right now? So what about this room is less than ideal? Like,
Lighting.
Ventilation.
so, did someone say old?
Mold.
Mold. You were the first one?
I don't know.
Dude, mold is a huge enemy when you're gonna cut someone open.
Blowing air.
Yep.
Particles and stuff.
Yep.
The dustiness.
Yep, so, yeah, I'm gonna show you ways out in the gym to kind of control some of these things. Yeah, the dust, the mold,
It's gonna be hard to clean.
the stuff in the air. I can go in any one of your houses, I don't care how clean you are, and I will find,
Yeah.
I'll find dust and
Carpet.
the carpet, yeah. So
Carpet's probably the dirtiest.
carpet's not ideal your house is warm and dry, so if you have to do something like this in your house, cover the carpet with tarps and plastic, because you're gonna be getting stuff on the floor anyway, and you wanna be able to roll up those tarps and stuff and chuck them in the burn barrel when you're all done. So dry.
So when you said that, my mind came, I have a lot of those chuck pads.
Chuck's pads are awesome. Sure, yeah.
What kind of pads?
Chuck's pads. It's like the big,
The big pads they use in the hospitals
Big
that they
absorbent
put
pads that are
underneath you
plastic
if you're
on
in a
one
hospital
side.
bed.
yeah.
Yeah.
Yeah, we love Chuck's pads. Yeah, we're potty training a kid. He's mostly potty trained, but on long road trips, we like to have that Chuck's pad underneath.
Or
Sadie.
like puppy pads. Yeah.
Yeah, yeah. And there again, pet supplies.
Yeah.
It's gonna be cheaper than the actual medical grade stuff, and it's gonna work just as fine. So go to a pet supply store and buy a whole bunch of puppy pads, or that's fine. So yeah, the next point. I want you guys to memorize all 4 of these points. I'm gonna grill you on later. So after clean is dry. So again, why do I say dry? Does it really matter that much? I mean, we're gonna be getting water and blood all over the place anyway, right, with our irrigation. Do we wanna start out with a room like that?
You don't know what's in the water.
No, exactly. Yeah, water is a conveyor of living bacteria. So we don't want a basement with carpet. It's a huge no-no. We want a dry environment with no chance for the bacteria.
We're fortunate to live here because it's so dry here.
Yeah, it was a really awesome environment for that. I lived in upstate New York for 5 years, and
Where about?
like Finger Lakes area.
That's where I'm from.
Oh really?
Or
Cool.
eastern or western
So yeah, I served my mission there, and I would put my Tums out on my nightstand, and you go to take your Tums in the morning, and they're literally falling apart from the moisture.
Or like charcoal. Or
Yeah, or your cereal, you have to get the plastic boxes to seal your cereal in, or But yeah, Utah's awesome for a nice dry climate. So hot. Do we want it just warm? How warm should your operating area be?
I don't know, they're always cold.
We are cool.
Yeah, so ORs are nice and cool, but what do you have for the patient?
Blended
We
blanket.
usually have what's called a bear hugger. You know what a bear hugger is, right? Yeah, it's this heating unit with this blanket over the patient that the hot air blows through the blanket and it's heating the blanket. So if you don't have a way to heat your patient uncomfortably hot for you, then you need to have the area
Warm enough.
pretty hot. So what ambient temperature can a person who is sick or have depleted energy go into hypothermia? Like, what temperature outside is that a concern?
At least 50.
52.
I don't know, even more than that.
53.
People down
70 degrees. Soldiers going through special forces training in Georgia have died in 70-degree weather because they were so depleted of their energy doing these 20, 30, 40-mile rucks. My personal experience, last year I did the Baton Memorial Death March, which is a marathon length ruck march. So I did 26.2 miles with 40 pounds on my back. And I was leading my team. I was in a team of 5 men. You have to cross the finish line together or you're disqualified. I got to within 0.2 miles of the finish line over an hour before the rest of my team, and I had to lay there on the ground and rest and wait for them. Within about a half an hour, I was shivering violently, and it was warm outside, and I was just in so much pain. My legs were locking up because my energy was depleted. You know, I'm a big guy. I weigh almost 270. I don't have a problem with heating my body most of the time, but after walking for 26 miles, my energy was so depleted that I could not maintain my own body temperature on a warm, sunny day, and I was going into hypothermia. Yeah. So that was a crazy experience that taught me a lot. So finally, my team caught up to me. I had to hold 2 of my buddies' rucksacks, and they had to almost carry me across the finish line because my legs were locking up, and it was pretty interesting
Same
experience.
with burns. If you get a burn victim,
Yeah.
you might want to cool the spot, but don't cool them down and immediately start treating for hypothermia, even though it seems warm enough, because they just cannot regulate their temperature. And once they get cold, they lose them.
Yeah. So yeah, a lot of times I've had to have another surgical tech, reach over with a towel and wet my face so I'm not dripping sweat on the patient. Because we had some of the procedure rooms in the 90s to take care of the patient. So yeah, if you don't have a way to directly heat the patient, the room needs to be as hot as you can make it. And another cool thing about space heaters is while that air is being sucked through that little space heater, it's killing all kinds of bacteria in the air. So we'll talk about that more when we go out.
So why is it when you go in the operating room, it feels like it's freezing?
Yeah, some of them are, and that's again because they have the cool bear huggers. They're able to make it much more comfortable for the operating people
Okay.
now because of the cool advancements in keeping the patient warm. But I don't have a bear hugger, and yeah, so I'm gonna have to do what I can to make the room hot if someone's really sick.
Your bacteria and stuff doesn't grow as well in cold either.
Yeah. Oh,
What was the
that was
fourth thing?
interesting. I was accidentally holding the button down. Huh? Okay. Click play.
Sam, what was the 4th thing?
So I'm gonna show you all these again really quick. I have
We missed the
Sarah's my tech. I suck at computer stuff. So yeah, smooth surfaces. This is the first one, clean. Smooth surfaces that can be disinfected. All towels and sheets washed with a good cup or maybe a whole bottle of hydrogen peroxide. Everything you're gonna use, like if I was gonna use my bandanas, the sheets for the bed, everything, that's an actual picture of me in the OR. So hydrogen peroxide is a really awesome way to deeply sanitize the cloth that you're gonna be working with. So the sheets, towels, hydrogen peroxide wash. A lot of washing machines have that sanitized setting. So do that, nice hot water, hydrogen peroxide. You don't even need any, it's better to not use any detergents. Just the cloth, with a whole bottle of hydrogen peroxide. Do that wash and dry it really good. So, clean air. This is another thing we were talking about. It's really important for an OR. So, positive pressure ventilation. What does that mean? What am I talking about? Positive where?
It goes out.
Yeah, so when you're stepping into this area, you have closed off for your operating room. If you open that door, you should feel wind coming out at you. So that's clean, filtered air. So every time someone breaches that barrier, it's pushing dirty air away and not allowing it to just drift into the operating area. So with a HEPA filter, we have one out there that we'll show you. So we have it's like a big, huge filter canister with a fan. So clean air, positive pressure ventilation, and then clean instruments, obviously. We're gonna do everything we can to make them sterile. Clean patient. Again, the surgical site. You're gonna start at the site and scrub in circles going away from where you're gonna cut open. Do that 3 times. So clean patient, and then obviously the clean surgeon, clean techs. Like when we were scrubbing in for surgeries, we would scrub each side of each finger 10 times. 1, 2, 3, 4, 5, count 10, count 10, count 10. Then we scrub the back of our hand 10 times, the palm 10 times, scrub our forearms 10 times, all the way to the elbow. And then we'd rinse it and let the water drip off our elbows. Then you walk into the OR, open the door with your butt, and then there's someone ready to put the gown on you, and you're putting your hands straight into some sterile gloves. And once you do that, then you're not touching anything else but that sterile field. Anything you need has to be brought to you. You don't get to touch your face if there's an itch. You know, if I needed my light adjusted, I would have to ask someone to adjust it. If my face, like I said before, if my face is getting sweaty and ready to drip, like, hey, I need a towel. Lean back away from the surgical area. You wipe your face. So yeah, that's
So
really
you
important.
wash your hands and rinse them, but do you dry them or do you have some sterile?
Nope.
So.
Well, I mean, they do have sterile towels, so yeah, you can pat them dry, you never wanna rub them dry. So sometimes they'll hand you a sterile towel, you can just kind of pat some of the extra water off. But most of that water on your arms is just going right into that surgical gown.
Okay.
So you get used to being moist inside of all the stuff you're wearing. So yeah, dry. No basements, no garages. Hopefully you're doing it in a room with a hard floor, otherwise you're covering it with tarps. Start with a very dry environment, and yeah, you're gonna make it wet, you're gonna make all that gross stuff, but start with a dry environment.
Can you
So
use
hot,
this-
yeah, sick and injured people can go into hypothermia. And then also what else you want hot is your saline and your sterile water that you're using for irrigation. Do you want to put cold water into an open wound when someone's really sick? No. So the idea Sarah and I had, you know those little warmer pots for like chocolate or cheese fondue or something? You turn on that warmer pot and you put some water in the bottom of it and you just set your bottle of sterile water or whatever right inside of it. Obviously in hospitals we have these cool warmers. It's just like a glass door warmer that keeps things at a good 90 degrees. But we don't have that, so take one of those little pots or a crock pot, put a couple inches of water in the bottom, turn it on warm, and set your bottles in there. So during the surgery, you can have someone pouring warm water in here, mix it up with your bacitracin, warm water for irrigation.
They're an ideal temperature.
Just around body temperature, around 90 degrees.
So like you would do like old days, the baby bottle, test it
Yeah,
on.
yeah, test it, yeah.
Test it,
yeah.
and you
And a
want it
cool
a
thing-
little bit warmer, because when you're putting it in
Yeah,
that
exactly.
cup, it's
Yeah.
going to drop.
Yeah, it's okay for it to be 100 degrees or so, because you're gonna pour it into the cup. Yeah, it's gonna cool down. And a cool thing I have, it's actually at my dad's house. They have these go to an auto parts store and they have this little
Oh,
gun. You
the
pull the
thermometer.
trigger and it tells you how hot whatever it is.
Oh, yeah.
So yeah, have one of those and check the temperature of your water. Obviously you don't want 120 degree water. If it's getting too hot, turn that crock pot off. But yeah, the last one is bright. Clean, dry, hot, bright.
Bright,
Remember those bright. You're trying to see some very minute detail, and you need it. You need lots of light. So then there's another thing, like, yeah, if you have a generator, it's awesome. And then LED lights are preferred. They use so much less electricity. With the generator, I'm gonna want to be running like my irrigation, my lights, and hopefully a dryer. Those are the main things I'm gonna want to be powered up with when I'm trying to do this. Because the dryer, I'm gonna keep throwing blankets and sheets in that dryer and just leave it going. Just let them get hot every 10 minutes or so. Swap out the blankets on the patient to keep them warm. So, and obviously if you don't have electricity, hopefully you've got like a wood burning stove or something. You gotta have some way to create heat. I would say if you can't create a pretty warm environment, just don't even try cutting into somebody, because you're just gonna kill them.
That's good. That's probably no okay down there. Dryer, and two other
Your
items?
dryer, your lights,
Lights.
and your suction and irrigation.
Suction
and irrigation,
irrigation.
yeah. Those are the main things you need power for.
Have you calculated the wattage required to run all that stuff?
No, and that's why I say you really want to use LED lights, because and you want to know that your generator can power a dryer. The generator I brought today isn't going to power a dryer,
Right.
so I know that. But I have two other generators at home, so you got to think of your situation. What kind of vehicles do you have? Like, do you have a diesel vehicle? Diesel fuel stores the longest without going bad. So if you have a diesel vehicle, you need to get a diesel generator and keep diesel fuel on hand. We have it's a Yanmar in the garage. Yanmar is a Chinese company that make great, and it's actual used military generator, and it's a pull start, runs on diesel or kerosene, and yeah, it'll power most of the house probably.
How do you spell that?
Yanmar, Yanmar. So Cummins makes a good diesel generator. Like, I'm talking like little, like your camping trailer size generators. They have all kinds of them that are diesel now. And the cool thing about diesel is it's not gonna gum up in a carburetor. And then I'll show you the generator we have out here is propane, same thing. A gasoline, so we have propane, we have gasoline, and we have diesel. So we have all those fuel options for electricity.
As far as your heat, they make a wonderful Chinese diesel heater. It's about just big square.
Oh, yeah, okay, yeah.
And they'll run for 8 to 10 hours on 2 quarts of diesel fuel.
Yeah,
And
My son-in-law has one for his ice fishing tent.
yeah.
awesome,
So
yeah.
you could heat a room for next to nothing, and they're under $100.
What's the name of those? What do I look for those?
Yeah,
Just go on to Vivor or Temu
There you go.
or Harbor Freight or any of those guys, and they just call them Chinese diesel heaters.
Chinese diesel heaters.
And they
Yeah.
are Chinese.
I'm a truck driver and we haul aluminum, and they want it to stay nice and dry so that it doesn't get condensation on it. So our trailers actually have a big diesel heater at the front. It looks like a reefer unit, like you would see for.
The opposite.
But it's a little 2-cylinder engine that fires up and it powers a big fan, and it can keep the inside of that trailer at 50 degrees even in sub-zero. So that would be a great. I'm thinking about getting one of them out on the side of the garage. But yeah, just runs off diesel, makes its own electricity, and puts out tons of heat. Like, there's some pretty cool options out there nowadays. But again, tailor your generator to what kind of vehicle, what kind of situation do you have? Like I'm saying, like we have that cool propane generator out here. Same thing, it's not a little gas carburetor that's gonna get gummed up. You can let it sit for years, and like Jim, it was Jim's, and I just opened the propane tank and I bled the air out of the line. Like second pull, it fired right up. Pretty awesome.
And inside, you wouldn't want to burn a diesel generator inside, but propane
No, there
would be
again.
safe?
Propane would be safer, but there again, you want extension cords, you want that generator on the opposite side of a good barrier from your OR. And that's another thing we're gonna show you is how to set up a temporary OR. So anesthesia,
Have a good CO detector.
yeah. But yeah, we would just let it run outside, bring the power cords in through a door or window or something, but. So you wanna go ahead and just cut into someone with no kind of painkillers? I don't think so. Yeah, I cut my thumb to the bone one time when I stitched up my own thumb. That wasn't very fun. I got the job done, and it was especially hard doing all the stuff with only one hand.
Yeah, that's a good.
But I got to the hospital and I showed Dr. Vanasupa. He's like, "You did a pretty good job," you know. But yeah, it was like the whole pad of my thumb, right to the bone, right there. But yeah, it sucks. So what can we do? What do we have that we can? Do we have propofol, the milk of amnesia, that we can knock people out with? No, we don't.
I have powdered lidocaine.
There you go. Awesome. Yeah. So local anesthesia is better than nothing, right? If you can't knock them out, try to numb the pain in the area.
Thank you.
So it might depend on, again, the wound
sorry.
and whatever, but I've heard that baby
Almost broke her
or
foot again.
gel.
Yeah.
know, that you-
Yeah. Lidocaine gel.
Lidocaine. I've
We
heard
actually
that.
had these cool things called Euro jets, and it was just lidocaine jelly, and it had a really smooth tip. You could squirt it into
Yes.
people's urinary canals before we did a cystoscopy. Cause I don't want a camera shoved up my wiener with no painkillers, you know. So we would put the Euro jet, and it made it completely numb, and it's just a simple gelatin. You can buy that sunburn ointment. Has a lot of it has lidocaine in it. And obviously, that's just a topical. If you're cutting into someone, it's not going to do you much good there. But so, what else can we do? What else do we have?
Alcohol.
Yeah. What else do we have in this area? So we can't play that movie. Ah, it was a cool video I want to show.
I'm trying to find.
Let me try.
Huh? He wants a sticker, he said alcohol.
Oh, we don't have the Wi-Fi on here. Dang it.
And that's the lidocaine.
Uh-oh. Now, how do I get back? Here we go. No? Sarah, I messed up. No, I didn't. I just clicked on the link. Where was it? Oh, there we go. No, back to the slideshow. Now we got it. So in this area,
You can use cocaine.
cocaine used to be the #1 thing prescribed for toothaches. I mean, yeah, not a good idea, but. So here's 3 things we have available in our, oh gosh, seriously?
Willow's poppies.
Where was it? Here we are. So one thing I'm thinking of, right down on the corner of like Main Street and like 4th South, there's a house that has tons of poppies. So again, this is less than ideal.
They have terpenoids.
Is Orson High, no,
Turbinoids?
Terpenoids, like, the spotted bee balm plant has that in it, and it can use something like that.
Spotted bee balm?
me.
See, this is why, yeah, discussion is awesome. Cause you guys need to think of things that I didn't think of here.
Joking.
So how do you get the opium out of a poppy plant?
You have to get them before they blossom, and you
So
score
it's a
the,
pod, yep.
the pod.
Score the
And then the white
pod, you
milk
let
will
the
come
sap
out.
come out, and you pull the sap off, you've got opium. So this, again, as long as regular hospitals and insurance is a thing, you're gonna go to prison if you're playing with this stuff. But if someone really needs it, you better believe
Hello?
I'm gonna be trying to make my own
Hey, it's
opium.
Alex.
Yeah,
You know, a
and
lot of
obviously
people-
there's medical marijuana. Medical marijuana doesn't actually take away pain. What it does is
Makes you
you
not
don't,
care.
you don't, exactly, you don't care about the pain. Yep.
A lot of people-
Good for you, Kathy.
Yeah.
You must have
So-
experience.
First-hand
So
experience.
alcohol is an option,
No
but
bad
why is alcohol not a much less than ideal option?
It messes with your patient's physical reactions.
Yeah, but also
hard
what
to-
is
hard to
it?
control.
What is it? Yeah,
If what?
Dosage, hard to control dosage? What did you say?
yeah, it's hard to control. She said it
Oh.
messes with the blood vessels and it thins the blood, and your blood can't clot.
Mm.
So I actually had a procedure once. I forgot to tell the doctor I had just taken an ibuprofen 800, and I was bleeding like a stuck pig from a pretty simple procedure. And I was like, he was like, man, you're bleeding a lot. And I was like, oh yeah, I forgot. So yeah, there's a lot of things. Yeah, if people are on heparin, you know,
Ibuprofen increase?
ibuprofen. Yeah, I took an ibuprofen 800, and the doctor was like, man, you're bleeding like crazy. And aspirin's the same. There's a lot of different things that mess with your clotting factor. Yeah, you can use alcohol, and it will deaden the pain, but you just got to make sure that you're on top of those bleeds as much as humanly possible if you're going to cut into them.
Turmeric is a blood
I
thinner.
always thought of alcohol.
What about
Turmeric, yeah,
people?
too much turmeric,
To clean.
too much cayenne helps stop bleeding.
It does both.
Yeah, internally, right? If you're eating cayenne, it'll make you bleed. But if you put cayenne pepper directly on the wound, it'll chemically cauterize.
Kyle, you were saying what?
I was saying a lot of people have leftover meds when they've had things, you know, and they've got, you know, their codeine, they've got their whatever.
That was like the next point I was gonna make. Is it legal to share your prescriptions with another person? No.
In a grid down,
But
yes.
if you're needing to do surgery on someone to save their life, are you gonna care about those rules? No,
No.
absolutely not. So yeah, I'm gonna be raiding my mom's medicine cabinet and taking some of those fun pills.
If you keep them, make sure you lock them up. It's an opioid, and if they take too much, it depresses the respiratory
that was
system,
that
they just
last
fall
one.
asleep and don't breathe. It's not good. And by the way, you can get free Narcan from the health department.
Push
You
over.
can get what?
Free
I guess
naloxone,
that's the last
Narcan, it's the antidote for
Okay.
an opioid overdose.
Oh, I didn't know
Yeah,
that.
everybody should get them there.
Well,
Utah County is
that's
free
the last one right now.
Please get free naloxone, because there's so many
I don't know.
overdoses on opioids.
Utah County, not Sanpete.
So,
Yeah, health department here, you can get
Sanpete
them.
has them too.
They give them to you?
oh yeah, one last thing.
That's called Norcan?
Narcan,
Narcan.
that's the brand, and naloxone is.
So why did I bring this?
Ether.
Whipped cream?
The propellant.
How can you use this? Yeah,
Put it in your mouth.
yep, the propellant.
The gas from it, yeah.
So, yeah, they taught us a lot of cool tricks in the Army. So yeah, it would take more than one can. But this is basically nitrous oxide inside this can. So you don't want to tip it upside down.
Oh.
You stand it straight up and just the gas is coming out. And you're gonna have the patient breathe
That's what
the
the kids-
entire can, and if they're still conscious, have another can ready.
That's what the kids do at the grocery store.
And you're gonna do it until they pass out. Now,
How long does that last? You have to operate? I mean, it's
Yeah, not
like
very
more than
long.
5 or 10 minutes.
not very long, yeah. But it, again, make them pass out, it's better than nothing. So,
So if they pass out with
Yeah.
that, then they won't feel, or will
Yeah,
that bring
you're
them like
unconscious.
two?
yeah, they're gonna wake up in a lot of pain. Cause, I mean, unless you have local anesthetic that's
Yeah.
deadening the pain. But at least while they're unconscious, they're not fighting you, they're not kicking you, they're not,
Okay, well,
you're trying to cut into them.
that's genius.
So, yeah. Good old whippets. So I prefer it like this.
See, I was wondering if they're laying on their back and you're trying to do that, how do you do it? That's
So yeah,
not big
nitrous
can.
oxide is still used in the OR regularly to this day.
So if you've got
So,
somebody laying on their back.
obviously, yeah, you have to,
Needs to sit up.
you could put tubing,
But
Yeah,
they
you
might
could
not be
put a
able to,
tube.
they've got gunshot wounds or something.
Yeah, I mean, you're gonna, if you can't sit them up for some reason, if they got, C-spine, whatever, if you can't move them, you're gonna have to, some type of tubing or something,
Okay.
but, yeah. Anyway, let's, move it into the gym. Oh, there's more? Thought we were done.
There's more.
People are getting tired. Oh, Chase Medical.
Jace case.
I just ordered myself a Jace case today.
Oh,
So yeah, promo code BECK for $10 off. So jacemedical.com. So who knows what the Jace case is?
I took it on
Who doesn't?
Carlson.
Who doesn't know it? So you go on jacecase.com,
How do you spell it?
Jase, jacemedical.com, Jase.
Oh, yes.
Yeah. No, it's not case sensitive. But, so you put in some basic information about yourself, your age, your sex, and your most importantly, your allergies. I'm allergic to penicillin. So you put that in, and then they give you a list of antibiotics that you can use, and they tell you, there's a bunch of suggestions what each antibiotic is good for. So we have, are those antibiotics in your bag? On the table? So it comes with, there's like 4 main ones, but it comes with a Z-Pack. It'll come with like cephalexin. So it based on your personal age and your allergies, it'll give you different antibiotics, and you order it, and you have those antibiotics on hand in case of an emergency.
You get erythromycin and things like that.
So yeah, if you're gonna be cutting into someone, yeah, erythromycin, yeah. You definitely want to have them on a course of antibiotics. No matter how good of a job you do keeping that surgical site clean, you want them on antibiotics for the recovery process.
Sam?
Yeah.
Can I make a comment about that? In doing the research for the Jace cases and being a frugal lifestyle, they're really expensive.
Yeah, they are.
They're several $100s up to $25,000 or $3,000 if you're getting extra for enough for family.
Yeah, for families,
amounts.
yep.
So there are a lot of places you can order all the antibiotics, as long as they're not opioids, you can order
Yeah,
from
like
India.
on the website, you have
Or
to
sometimes-
promise that you're not ordering them for a current condition. You have to promise you're not
Yeah.
ordering them for another person, that kind of stuff. And then then they'll ship you this Jace case for
The
you.
one thing I really, really like about it though is peace of mind, because you
Yeah.
know that the meds you're getting
Yeah.
are real true meds.
And the cool thing, they're legit.
Because if you get
quality
them
meds.
from other places, my
You
fear
do
is
take the
like,
risk, yeah.
Yep.
what if it's
Yeah.
not 100% pure? What if it's not what they say it is? I just,
Mhm. Yeah, and the cool thing is you're cleared to travel with it. And you can tell them what countries you're planning on visiting, and they'll give you different malaria meds or whatever. Like, it's a really cool program. Tell them what you need, who you are, and they'll give you some emergency medicines to have on hand for you. So I highly recommend something like that. Like, my grandpa would buy veterinary penicillin, and whenever someone was sick in the family, he would give them a shot in the butt, like, whatever,
it's still
do what you
human.
have to. Yeah, but
True.
Pet
We
meds
have
are
a guy who
human
was a
meds.
veterinarian who, he retired, but for years he didn't, turn off his ability to get meds.
did they give
Finally
you one of those?
moved to
You
northern
need that?
Idaho, and he said he was sorry that he did.
Yeah. So yeah, the Jace case is awesome.
we represent Mount Pleasant, Fairview, West.
Freedom.
Freedom, Manti, and how about you?
Mount Pleasant.
Mount Pleasant,
Mount Pleasant, yeah.
of course, Spring
So
City.
this is a lot of San Pete here, huh?
Well,
North
spread
Central
out.
area, yeah,
So,
yeah.
I don't know, in thinking of this, it almost seems like each community of people who are concerned almost needs to know of a spot in their community
Yeah,
that they would be clean, not crazy like this, and almost have somewhere a stockpile of something. I
Yeah.
don't know if
Well, while
that's.
we're dreaming, let's have a doctor there too.
yeah.
Yeah, well, it would be just about all that
Yeah,
dreaming,
hopefully you
yeah.
can find a doctor. or someone who's crazy, willing enough to try it. So yeah, thank you. The end. Okay, now we get to do the cool. Let's move it into the gym, and I'll show you